The Shadow Health Minister Anne Ruston. Anne, thanks so much for your time. Do you broadly support these measures?
Well, look, of course, we support anything that's going to prevent our young Australians getting access to vapes. I mean, we do not want to see a generation of young Australians getting access to something that is obviously very bad for their health. I suppose our greatest concern is whilst it's great that we've got a reinforcement of the regulations, many of which that were already in place, but I accept that we have gone a bit further by the announcements on Monday and Tuesday. It's about enforcement. We need to make sure that the existing laws, I mean, we have very strict regulations in Australia already about access to nicotine-based vapes, but they aren't being enforced by the states and territories. So I think there's another piece to this that's really, really important, and I'd like to see what the government intends to do about forcing the states and territories to enforce the regulations that are already in place.
What regulations are you talking about?
Well, we know that the majority of vapes that are being sold on the street corner, you know, your little bubblegum vapes in little pink tubes that are obviously targeting young people, most of them, 98% is the estimated amount, actually have nicotine in them. They are illegal. So states and territories need to enforce the fact that those vapes should not be being sold at all. So I think the really biggest issue that we have seen over recent times is the fact that we've got regulation that isn't being enforced, and we would support any action taken by this government or the states and territory governments to ensure enforcement was the number one issue, because if we can get rid of 98% of those vapes by enforcement, we are well on the way to stopping young people getting access to something that's not good for them.
So what are you talking about, police raids on convenience stores where most of these vapes are being bought?
Well, I think obviously there would be a range of measures. I mean, you know, there are rules around the regulation of the sale of products, restricted products in Australia. And I think, you know, the states and territories obviously have a range of those measures that are available to them. But, you know, if you go into a vape store, I mean, you or I could walk into a store, convenience store, and buy one of these products. It'll be sold to you as not having nicotine in it. It probably will have nicotine in it. I mean, I don't know why the enforcement agencies in the states and territories can't do the same thing and then apply the appropriate penalty when they find out that they've got a product with nicotine in it.
Yeah, isn't the problem though these vapes getting into the country in the first place? It's obviously too easy because there's millions of them.
Well, it once again comes back to an enforcement issue. They aren't allowed to be imported with nicotine in them unless they're coming in on a prescription.
But that would be a federal issue, wouldn't it? Yeah.
Yeah, absolutely. And we would support the government 100% in enforcing, the requirement for Border Force to be able to take the necessary action. I understand that some changes that are being proposed around non-nicotine versus nicotine vapes will make it easier for Border Force to be able to enforce this, and we certainly support that. But I mean, my main concern is that we've focused very, very much on the regulation, and to be fair, it's been a bit of an airbrush of existing regulation. What I want to see is the enforcement, the real practical actions on the ground that are going to make the difference for young Australians not to be able to get easy access to these sorts of products.
Yeah, is it fair to say, with a bit of hindsight, now that we see this explosion in vaping, it's been happening for a couple of years, that your government wasn't quick enough to act? I know Greg Hunt moved to this prescription model, but that has pretty much failed, hasn't it?
Well, I'm not necessarily sure that you'd say the prescription model has failed. It's been the enforcement of the other requirements and regulations that has failed, and I think that is the point. A prescription model obviously is a way of restricting access, but we also, you know, we have to look at the here and now. We've got 2 million Australians estimated that are currently vaping. If we make access to vapes almost impossible for them overnight, we really do need to be concerned about what happens then. What are the actions that the government's going to put in place to try and deal with black market activity? Because we know inevitably that's what's going to happen. We also have we don't want to see people who are vaping now move to cigarettes because it's easier for them to get cigarettes instead of vapes. So, the headline is great, but it's got to be the detail about how this particular measure is implemented on the ground that will tell the difference between its success or failure.
What is the opposition's attitude moving forward on this? Because, you know, these are big reforms. They might not work. The government is going to need to be quite flexible and agile in responding to, you know, the way these reforms move the market or change behaviour. Are you pretty much offering bipartisan support on this? Are you willing to throw everything at it?
Well, the one thing I think that as an opposition we'll be very happy to throw everything at is to make sure that access to vapes to young Australians is the number one priority. But what we will be throwing all of our energy and effort, and I certainly will as the Shadow Health Minister, is making sure that what we're doing is actually working and that we are pragmatic and responsive when something may not work, or we, you know, in the case of the black market, we know that is likely to be an issue. Making sure that we are quick to act so that we don't see loopholes and unintended consequences of legislation that may well have the best intention, but making sure it's actually delivering the outcome.
Anne Ruston, thanks so much for your time.
My pleasure. Thanks, Laura.